A pediatrician's guide to common childhood illnesses. As a parent, seeing your child sick can be incredibly stressful. My goal is to help you feel more confident about when you can manage an illness at home, and most importantly, when you need to call a doctor. Let's go through some of the most common childhood illnesses. The common cold. A cold is a viral infection, and it's something every child will experience. Symptoms typically include a runny nose, which may start clear and turn green or yellow, a cough, and a mild fever. The most important thing to remember is that antibiotics do not work on viruses, so they won't help with a cold. Instead, the best treatment is supportive care to keep your child comfortable. Hydration. Make sure they're drinking plenty of fluids. Humidifier. A cool mist humidifier in their room can help ease congestion. Saline spray. A saline nasal spray can help loosen mucus, which you can then clear with a nasal aspirator. Gastroenteritis, the stomach flu. This is another common viral illness that causes vomiting and/or diarrhea. The main danger here is dehydration. The goal is not to stop the vomiting or diarrhea, but to replace the fluids your child is losing. Offer small, frequent sips of an oral rehydration solution, like Pedialyte, rather than large amounts of water or juice. Watch for signs of dehydration. This is the most critical part of at-home care. Call your doctor immediately if you notice. No wet diapers for several hours, in infants, or infrequent urination. No tears when crying, sunken eyes or a sunken soft spot on an infant's head, extreme lethargy or unresponsiveness. Fever. A fever is a symptom, not a disease. It's actually a good sign that your child's body is actively fighting off an infection. How your child is acting is often more important than the exact temperature reading. When to treat a fever. If your child is uncomfortable, fussy, or unable to rest, you can use a fever-reducing medication like acetaminophen or ibuprofen. If they are old enough, always check with your pediatrician. When to call a doctor immediately. A high fever in any infant under 3 months old. A fever that is very high, over 104 degrees Fahrenheit or 40 degrees Celsius, at any age. A fever that lasts for more than a few days. Critical red flags. When to seek immediate medical help. While you can handle many illnesses at home, it's vital to know your limits. These are the signs that your child needs to be seen by a doctor or go to the emergency room right away. Difficulty breathing. Look for fast breathing, flaring nostrils, or a sucking in of the skin between the ribs or at the neck with each breath. Altered mental state. If your child is difficult to wake up, unusually drowsy, or becomes extremely irritable and can't be comforted. Unusual rash. A rash that looks like small dots or bruises and doesn't fade when you press on it with a glass. This could be a sign of a very serious infection. Severe dehydration. As mentioned earlier, signs like a lack of tears, no wet diapers, or a sunken soft spot need immediate attention. Remember, you know your child best. If you ever feel that something is seriously wrong, please do not hesitate to call your pediatrician or go to the nearest emergency room. Trust your gut. That's what we're here for.